Now, talking about the causes of retrograde ejaculation. The underlying causes of retrograde ejaculation can be due to some medical causes. They might be pathological. They might be due to some neurological involvement, like as the nerves of the bladder or the male organ might get involved, leading to retrograde ejaculation. Hello everyone, I am Dr. Sonal Anand and I am working as an IVF specialist in Crysta IVF Lucknow. Today we will be discussing about a condition which people generally do not prefer talking about, that is retrograde ejaculation. The first thing which comes to our mind is, what is retrograde ejaculation? So I'll put it into very simple words. See, normally when a male has to ejaculate, the semen is ejaculated out of the male organ into the female tract. But due to some reason, if this ejaculate is not through the it does not go into the tract and instead it goes into the bladder, then we define it as retrograde ejaculation. Now, talking about the causes of retrograde ejaculation. The underlying causes of retrograde ejaculation can be due to some medical causes. They might be pathological. They might be due to some neurological involvement, like as the nerves of the bladder or the male organ might get involved, leading to retrograde ejaculation. The next thing which we need to figure out is that, is this condition treatable? Yes, it is treatable depending on the cause. If the cause of the condition is due to some drug or due to some pathological condition like diabetes or maybe hypertension or a predisposing factor like neurological factor like Alzheimer's, etc., then yes, we can actually try according to the inciting factor. But if the involvement is neurological, that is where it involves your nerves, then we have to reconsider and then it would be labeled as a cause of permanent retrograde ejaculation. Now you would ask a patient, can a patient conceive with this kind of situation? No, but then I would like to point out that first we have to figure out the cause and actually whether we are going through the condition of retrograde ejaculation or not. So when you go and consult a doctor, your doctor tells you to go for a husband semen analysis. If somehow we analyze the semen and we don't get any kind of sperms, we might look into the urine of the patient. If on urine analysis we get sperms into the urine, then the condition is labeled as retrograde ejaculation. If it is a temporary retrograde ejaculation, we just have to remove the cause and we end up having the result. But if it is a permanent retrograde ejaculation, then the question arises, how can we help the patient? Now here what comes in our favor is the medical science advancement. The medical science has a lot of technical advancement in artificial reproductive techniques. So somehow if a male is undergoing or suffering with retrograde ejaculation, we just retrieve the sperms from the urine and we can actually use the sperms of the patient for the process of conception. So this is how our patients can be benefited even in the condition of retrograde ejaculation. Hopefully, this video would help you with lots of aspects of retrograde ejaculation and might motivate those patients who might be actually hiding the cause or maybe suffering with the psychiatric state of retrograde ejaculation. Thank you with this, and I would like to invite more questions and queries regarding this topic to help the people out there.